Okay, well, welcome everyone. We'll wait for a few more CAC members to show up. I did want to provide an update on that survey that we sent out a couple of weeks ago. It came from Gwen. On that survey, we asked a few questions covering different topics. The first topic was around the CAC chair and vice chair roles and responsibilities. From that survey, Gwen took those edits that were provided and made those changes into the document, and those were sent out yesterday. And so we'll have that for you to approve on the consent agenda today. And then the second topic was around the community health projects. And so these are the projects of the CAC funds every year starting last year that are around social determinants of health and health equity and must align with the RIP. And so we asked you some questions around the process just to kind of get this conversation started this year. So the first question we asked you is if you would like to narrow the topics and kind of select maybe one social determinant of health to focus in on. And the results were split 50-50. So we'll have more conversation at a future meeting, maybe next month. But we did receive feedback that if we did want to narrow the topic to one social determinants of health, economic stability came in first place. And then we also asked you a question around the reviewing process. So last year, since we had 42 applications, we split the CAC members into 4 different reviewing groups. And we took the scores from those applications from the reviewing groups. And that's what you had discussion and kind of based your decision off of. Results from the survey indicated that you would either like the whole CAC to review all of the applications or do 2 rounds of scoring on those applications. And Gwen and I will share with you kind of another way to do this through like a letter of intent, if that's the direction that you'd want to go. The next topic covered on that survey was around the process for handling emerging issues. So things that arise through public comment or concerns that come up through the CAC. And that we'll be kind of working on later today. We asked you if you wanted to pull together a small group to be working on that outside the meeting, and the CAC said yes, and 6 of you volunteered, so thank you. Next question, we asked you if you wanted to keep the meeting times to 90 minutes and have more work outside the meeting, or if you wanted to switch to a 2-hour meeting time over Zoom. And 90% of you said, please keep it to 90 minutes, and we're happy doing work outside the meeting. The last topic that we covered was the PECS reloadable debit cards. And this is a question for the consumer members, because this would be a way for folks to kind of receive their stipend instead of receiving a check by mail. And with this reloadable debit card, we want to have all consumer CAC members use it or none. And so 83% were in favor. And so I guess more discussion around that with the consumer members. So any questions on that or any of the other material that we sent out between the meetings? All right, I'm going to turn it back over to Brad.
Thanks, Michaela. So no questions or comments regarding that feedback on the survey? Are we going to schedule time later to actually have a discussion on that, or is now that time?
So around the community health projects, that discussion will happen in another meeting. With the PECS reloadable debit card, that will probably happen offline with the consumer CAC members.
Okay. All right. Well, welcome everybody. We do have at least 9 of the CAC members present, so we have a quorum. And if everybody would please write your name and affiliation in the chat box, that'd be great. And that will open it up for public comments. Anybody have anything you'd like to share as public comment? No public comment. Does anybody have a story you'd like to share? Medicaid service type story. Positive, negative.
I can share.
Okay,
Am I
Leslie.
invited?
Yes, sir. You're invited.
Okay. I can't stop telling this story, so Kristen's heard it 8,000 times this week. We at Pacific Source, we got actually the Health Council also got notified from Jennifer Little at Northern Klamath Public Health, or sorry, Klamath Falls Public Health, Klamath County Public Health. Good Lord, excuse me. We got notified that they were going to do a pop-up clinic yesterday for COVID vaccinations, and this was about a week or a week and a half ago that she notified us and was asking if we could do any outreach to help, you know, kind of find those members in Northern Klamath or South Deschutes and see if we could get them registered for appointments to get a vaccine. Long story short, we were able to get a list really quickly of all of our Medicare and Medicaid members in that region. And so we called, I think, 137 people in one day, and the appointments filled up in like 2.5 days. So, and then they had it yesterday, and there was a news story on it, and everybody was really thrilled that they were able to come down there and do a pop-up vaccine clinic, since it's a pretty rural area, and sometimes you have to travel an hour to get services. So I was really pleased about that. And then my other fun story about that's really Kristen's story, is that I had previously, Kristen had actually connected with the local radio station there that has a show called the Bill and Gil Show, and I have spoken on that radio station. I'm like a mini celebrity, haha. And so I said, hey, why don't you reach out to your friends Bill and Gil, Kristen, and see if we could get on the radio, or we could get the pop-up clinic on the radio. So she did, and they were going to announce it every hour, and it was going to be great. And so we were really just, from a community partner standpoint, asking for some, you know, kind of free advertising, if you will, for Klamath Falls, or for Klamath County Public Health. And so when she did, then Gil called her back later and said, you know, I want to get me and my wife signed up. Could you help me? And so she helped get them an appointment. And I just thought it was such a high touch customer service moment, where we weren't reaching out to them at all, you know, for their own selves to get vaccinated, didn't even know if they were eligible, but clearly they were. And then Kristen went the extra mile to get them registered and vaccinated. So it sounded like it was a really good turnout yesterday, from what I saw. And I don't know, I didn't see if Jennifer's on, but clearly they were able to mobilize, and it looked like it was a really good experience for all.
200 vaccines provided. I just saw in the chat. Nice. And did you say that was Klamath Falls, or was that another smaller town in Klamath?
Yeah, it was It was in Crescent, so Northern Klamath. Yep.
Yeah, nice. 200 in Crescent. That's great. All right. Thanks, Leslie. All right, we'll move on to approving our minutes. Hopefully you all had a chance to look over the minutes, and are there any questions or clarifications? Sounds like no. Would somebody like to make a motion to approve the minutes?
So moved.
February 11th? Was that?
I said so moved.
Was that Linda?
Yes.
Second.
I'll second, Brad. This is Ken.
Okay. All in favor, you can either say yay in the chat.
Or yay
Let's
on
do
the
that.
phone.
Or yay on the phone. Thank you.
Yay.
Is that a yay? Okay.
Yay.
The enthusiasm is overwhelming.
Makes me remember the old Tom Slick. I don't know if anybody remembers that. Yay. Tom Slick cartoon. That goes way back. Okay, any opposed? All right, we can move on. The meeting minutes from February are approved. Next is our consent agenda. We have the CAC chair and vice chair roles and responsibilities. We would like to approve those. Are there any questions, comments? Hopefully,
This is Linda. Board is in the process right now of finalizing our policy book. And in the policy book, it has roles and responsibilities for chair and vice chair. So I'm just going to take a look at that and make sure that they're consistent with each other.
that makes a lot of sense. Thanks, Linda. Do the folks who really put in the effort to develop these feel confident that they are in alignment? Even if there's maybe some small wording differences, but the spirit and the gist, I guess, are in alignment. Yeah. I guess I'm asking, do you feel confident that we could vote on these and not later come across conflicts with the board's version?
Is there any input from people or any changes that were?
There were 2 minor wording changes. In one line, it was called out to be specific about meeting agenda planning. And then the other conversation that I think is included in the line was shifting from qualifications for service. It was originally 6 months to 1 year, and there was a community CAC member that felt strongly that it should be at least a year. It's right now, it's outlined as 6 months to 1 year to allow some flexibility for people's capacity. So those were the 2 main points of change. Oh, and then the other one, I take that back. The third is reflected here. That third bullet under shared requirements, that the final change was 1 service term of 2 years. And can serve up to 2 consecutive terms for a total of 4 years.
Okay.
Any other comments or questions?
Does the person who advocated for a minimum of a year feel like we want to discuss it as a group? Are they comfortable with 6 months to 1 year in the second bullet under shared requirements?
That individual is not at this meeting today.
Okay.
Well, I can speak up. I'm the one who asked that it be reduced from a year to 6 months. Just because I think it is important that the person have experience, but I don't want to, I guess, tie our hands. I'm sure there's a way to work around it if it says a year and we absolutely needed somebody to fill the spot. Probably a way to work around it, but I don't know. I'm just not convinced that you need a year's worth of experience. It's going to depend on the person.
All right.
Great. If they've got a strong leadership background, for example, then just a quick study on the topics and the issues.
Yeah.
I can live with the way it is.
Any other questions, comments? Would somebody like to make a motion to approve the consent agenda, the CAC chair and vice chair roles and responsibilities?
Okay.
That's Lauren.
Yes.
Thanks, Lauren. Is there a second?
Thank you.
Would anybody like to second? Larry. Thanks, Larry. All right. Business is taken care of. Thanks, everybody.
We got to vote.
We didn't vote. Why do I always forget that? Yes, thank you. Whoever said that, thank you. Please use the chat to express yay if you approve or yes. And anything else if you do not. No or.
A phone yay for Chris Woodard.
And Chris reminds me again. Thank you. Yes on chair rolls. All right. Are we getting enough support? People who are tracking the chat? Yeah, okay.
Mhm.
Thanks, everybody. Is there anything else to cover in the email? Dan, we kind of jumped ahead for those of you, for anybody who joined a little bit late. We jumped ahead and covered, Michaela shared with us the responses to the survey that I think we all filled out, or most of us, many of us filled out. Did all of us fill it out, Michaela, or do you have a percentage or?
Most, Gwen, do you know the total number?
Yeah, it was 12
Okay,
total.
Got it.
So pretty good response rate.
a good response. Good. And there will be follow-up on some of the items that were, I guess, not resolved or not what it didn't have full agreement or need further discussion, either in our next meeting or offline through email or phone. Anything else for that section? Email material and announcements? No? Okay. Well, let's move on. We're ahead of time. We're doing good. And we'll invite Miguel Herrada from Pacific Source to talk to us about class standards.
Thank you so much.
Yeah,
Thank
yeah.
you so much. Yes.
Hi.
I'm sorry. Okay. Yes. So thank you so much for having us again. Seems soon for another presentation, but I'm pretty happy that this one is that we will enjoy this one, because it is, frankly, it is a tool. We can use this as a thinking tool when we want to report or evaluate how an organization, that could be a medical center or a clinic or any other organization, how they are responding to the needs of the memberships in a way that is appropriate from the point of view of language, but also from the culture, and more important, that they are including the members and the community partners in a way to create solutions together. So this is the challenge for me today, to share with you what are the class standards. Class stands for culturally and linguistically appropriate services. And more important, how can we use these 15 class standards to think and evaluate and recommend improvements wherever we can find them. Next slide, please. And of course, please interrupt me at any moment. If you have questions, don't wait until I advance. Any moment, please. So I will not give you an history of what is class and why we are using that, but it's enough to say that this is a tool. This is a national tool. This is something that is used in all over the country for at least the 10 last years. And there is a big advantage with that. And the advantage is that being a national tool, many people is using that and producing and sharing reports and experiences about how this tool has been used. And that is a great advantage, because there is almost any example or case or developed tools available free on the online for whatever we want to measure about these class standards. Next slide, please. Yeah. So we are already using class standards. Just to give you an example, I think last year, I was here presenting the health equity plan that Pacific Source has built. And not only the health equity plan, but all the work that we have been doing for years at Pacific Source is inspired directly from the class standards. So, and many other tools that we are already working now, like the so-called transformational, the TQS, the transformational quality measures that we use, our health equity plan, the anti-racist policy that we are developing, the creation of the dedicated positions like mine to advance equity, the creation of a new value for Pacific Source, specifically talking about diversity, equity, and inclusion, etc. All of this is a reflection about how we are using class to improve our ability to answer the needs of the members in a more appropriate way. Next slide, please. So we are not going to see all the standards. There are 15 of them. The most important one by far is the standard number 1 that expresses the main idea, which is commit to high quality care, obviously supporting diverse cultural beliefs and communication needs. Now, many times when we hear class standards, we like to think that class standards is just about language or ethnicity. It is not. It is more than that. The standards 5 to 8 that I put in bold there, they focus on language and language assistance and communication, culturally appropriate communication, but all the others are applicable in other areas that we were to improve also. So standards 2 to 4, they speak about governance, leadership, and workforce, and the standards 9 to 15 about engagement, continuous improvement, and accountability. So how the organizations could benefit from working collectively, collaboratively with community partners and the members, and how this work could become an improvement for the entire service. And I think this is very important for a group like yours. So let's jump into at least the standards number 2 to 8. Next slide, please. Yeah, so standards, do I have the other slide, please, before that? Do I have one? Oh, maybe we eliminate that. Okay, so let's jump into the 5 to 8 standards. Next slide, please. Yes. So as an example of how the CAC can use the standards, I think this one makes very clear what is the use that we can do. If I'm a member, if I'm a user, if I'm a client, a patient, and I go into a clinic, I can use this set of questions to easily evaluate if the place I'm going is appropriate for my needs as a consumer. And you can be any minority. It could be about access. You can think about this not only about language, but about access in general. So as a Latino, as a Spanish speaker, if I go there and then I can easily understand, so am I offered to free language support that by law, everybody who has Medicaid and has the right to request that if it's needed. So that exists. The clinic where I go, do they offer me an interpreter? Do they have an interpreter? Is that available, or is that easy to have? Or maybe that takes 1 week or 2 weeks to have an appointment with an interpreter. So there are many things that we can learn from that, right? So are they telling me that it's available, that the help is there or not? The number 7, once I have the service of interpretation, for instance, so are the interpreters, the quality of the interpreter is appropriate? So are they clearly trained to do that, or they are using whoever has a few vocabulary in Spanish and they use it? I've been in interpreting for doctors that they know only a few words in Spanish and they think they don't need an interpreter, but they just can say, they just can entertain just a normal conversation, not a medical one. So, but because they speak a little and they've been in Acapulco several times, they think they don't need it. No, this is serious, right? So we can ask also we can ask ourselves if the organization is providing that. Or number 8, provide easy to understand materials. So are the materials I'm receiving not only translated or even in English? Can I understand the materials that I receive, or the instructions that the doctors give me, or the pharmacist, or the follow-up when I talk to the nurse? Maybe all the words are there in English, but that's not enough. Sometimes the terminology or the way of the process is so complicated. So those are important questions that we can ask ourselves about that. And the class standards help us to go to this interesting list. So next slide, please. So what I would like to do, if you agree, is to try to create an imaginary scenario where we try to report our experiences. And I choose this one. So easy to understand materials in the language and format that I can use to follow up my treatment, or to get to the materials in a way that I can understand. So imagine that our goal is make sure that materials are available in a preferred language and format. And so I put an action there, but it's just an imaginary action, just to begin the discussion and conversation. Maybe one action could be review materials and advise the CCO about gaps and opportunities to improve. But maybe there are other ones that are needed. So this is one very practical use of the class standards. I would like to know more about if this is one exercise that you want to do with the standard number 8, or maybe you prefer to use any other of the 15 standards that is that you have in mind right now because of your work, and we can use any other one to play this game. And I stop there, and so let's begin the conversation. Or open to questions.
Anybody have any questions? So,
I do.
okay, Teresa.
Do you follow up somehow with people who are actually clients on whether they're using the reading material or whether it's helping? Or is it, I mean, we do get, I know we all get sent when we're sent letters, it's in, can be in multiple language, or the discrimination is in multiple languages, and you can call a number to get your language. So that's one question, is, are you following up to see that it's beneficial for clients to have it in whatever language they speak? Probably Spanish is the one that's the most used, I'm guessing, beyond English. And the other thing I wondered is, what do you do if you don't have interpreters available? And how do we get interpreters? And how are they screened, or are they just other clients, or, you know? Because if you don't speak English, it's very comforting to have somebody in your language and very helpful. But what if they're not there? Because I have a feeling we don't have a ton of people.
You see, Teresa, I see 2 questions there. The first one is about the materials, and the class standards tell us that it's not only about language, but it's also about format. So for instance, we can have the materials translated in Spanish, and we have a beautiful flyer that we are going to publish in a web page, for instance, about COVID information. Well, Latinos don't use computers to go into web pages.
Right. Okay. So that's very important to know, because then it's kind of wasteful to send them flyers.
Absolutely. So if we have, we are in compliance, right? Because we have the English information and we have the Spanish information, so we can check the box. But is that effective? No. is not effective. We need to think what this community need in what format. So it's not only about language, it's also about the way they use the communication, they process the communication. For instance, LCA has been very effective in this time of COVID, understanding that. And so they are covering everything. Facebook, because Latinos use their phone. They don't use computer, but they use their phone. So it's more difficult to get into a web page, but maybe the Facebook, it's easier to read, right? Just the post on Facebook. But they are not only doing that, they are also making phone calls to the members to tell them that it's their turn, they can have the vaccine, they are eligible, and helping them to get into the clinic and make an appointment. So that's what this example about provide easy to understand materials in a format and language according to the culture and the language. So the second question you made was about how are you getting this information in a way that you can use to process and define what is the appropriate format for that. So clinics have very detailed information about what is the ethnicity, the language, or the format that this member needs, but we don't have yet a very strong communication between all the clinics or a way to really know on detail what are the characteristics of each community and what do they need. We still need to work a lot on that. And you are our support, right? So you can help us to do that.
Mhm. So if you're in a clinic and there's nobody to interpret it, what do you do for the patient? I'm just
Yeah.
curious. I'm sure this is all work in progress, but
That's a big problem, right? So so the idea is that all our providers, and the big providers, well, not necessarily the big, but there are some providers, and I need to put that name out. So Mosaic, for instance, Mosaic has making an effort for years to develop a system to produce their own interpreters. So they have in-house interpreters, and they have training with a trainer of trainers inside the company. So whoever you go, almost to every Mosaic clinic, you are almost certain that you will find a medical interpreter inside the group. But there are other, sometimes bigger organizations that they don't have that, and they haven't invested yet on have that. They maybe prefer just the phone call and give you an interpreter by phone calls, but there are others that they don't know how to do that, and there are even some that they don't want to do that. They have no interest on providing that, and you can wait 1-2 weeks to have an appointment with an interpreter if you ever have. And if you are late or the appointment moves a little, then you lose your interpreter because the interpreter has a limited time, right? So it's very complicated.
We know that they offer like language lines, but again, they don't like using them because they don't understand the way they're speaking. It's a whole different dialect to them, and they have no idea what they're talking about. And it's kind of sad to invest all your money into those language lines and not be able to use them.
Thank you, Regina. That's so important. I'm sorry, Leslie. Yeah.
No, go ahead. No, I want to underscore that piece, and thanks for sharing, Regina. But I also want to just, I know this has been brought up, but we do have those, I guess, language lines, if you will, available. There's multiple vendors that we work with, and we give that information to our providers, and they're welcome to use it. I understand that it's not a great option, but this is just about accessibility. So if that's the last possible option or the only option people can use, then we're happy to offer it. We actually did do a survey last year of our members that utilized that service, and it was surprisingly satisfactory. I think we were all expecting to hear a lot more negative response, but I recently saw the results again, and I think people were just glad to have something.
There's just so many out there now, and it's hard to see which one is doing it. It's just at the health department in Prineville. There's myself, and there's also a person that is officially a interpreter there. But when we're not available and they have to use those language lines, they're like, nah, I'll just wait, I'll reschedule, you know, things like that. And it's only because they still have 101 questions after they're done talking to somebody that speaks the language line that is actually speaking their language. They have no idea what they're talking about in some of the resources that we have used at the health department. Now, like you said, there's different ones and there's newer ones coming out, and hopefully those ones will work, and we can help more people. But again, it's not a friendly visit. It's kind of like talking to a robot, right?
Hey, Leslie, real quick, was that a survey of the customer, patients, or of the providers?
Yes, of the clients, the people that have actually used the service.
Okay.
Which one is that?
I can find out and let you know. I used to remember. I think we have 4 contracts, but I'll let you know.
Sure. Thank you.
So this is the idea that we bring to you this morning, is about this tool that help us understand different levels of the system. We explore only one this morning, but I invite you to review the list that we sent to you. There are some interesting that it's about, for instance, how the CCO or the medical system is collaborating with community partners and members to improve their own services. So about sharing responsibility or sharing the power and collaborating, accountability. So I invite you to check all of them. They have been very useful for us. They have guided our thinking, and we are constantly finding more opportunities on that. And as I said, it's being a national tool. There is always someone that has already tried that in other places from where you can learn and even use their tools to improve. So thank you so much for the opportunity to be here again. And if you don't have more questions, I will end here.
Miguel, there is one question in the chat. It says, what are the expectations on the clinics to use the class standards?
Yeah, so obviously not every clinic is at the same level, right? As I described later, Mosaic has invested for years in developing an answer, a comprehensive answer about how to use the class standards, and because it involves everything. It involves the leadership, the board, even the representation, the groups that support the work. So it's a complex system to advance class. And there are tiny family clinics that obviously they don't have the ability to do that. So the answer is different to each of one. Our hope is that at least everybody understands there is a need to offer the services to the patients and create at least a rudimentary, a basic policy where this use of class standards, this idea of creating a quality service that is appropriate for every minority members is part of the organization. So we are pushing the class standards. The class standards, it's in our contract now. We don't expect that every provider will adopt that at the same level, but we really want that everybody understand that this is something that we want because it improves the quality of the services. It creates better ambiences, welcoming experiences for the patients. And bottom line, it helps to create less problems on the equity side of the health delivery services.
Is this only minority?
I'm sorry?
The class of standards, this is Lauren. I'm just wondering, it's not just a language barrier in minority, it could be a communication how anyone is treated, kind of like when you look at your Pacific Care book, your patient's rights? Does it fall? I mean, communication is not always just a language. Sometimes it's you're not being given information, or you could have lack of communication without even a language barrier.
Thank you, Lorraine. Yes, it is not just about language access. It's about culturally appropriate services. So it can be in the format. It can be the way that the information is delivered. So, for instance, a homeless person has different ways to access information and to use it. So we need to think on this community. So because they have no address or they don't. So we need to be creative and adapt that. So yes, so even if you are an English speaker, but you have a low literacy, that by the way, many people refer to us in our listening sessions that even if they have masters or PhD, when you are talking about medical situations, even if it's in English, it could be very complicated. So it is for everybody, elderly people, young kids that need support. All kinds of minorities, yes.
Thank you.
This is Linda. Can you give us an example of how the class standards would evaluate or implement something that would protect an English-speaking population that is being treated not equitably? How would you identify it? How would you intervene using the class standards? That part's unclear to me.
Yeah, so I will say that when one of the most important aspects and the first part of the class standards about governance, leadership, and workforce is very important. So for me, one of the aspects that are make evident that the resources are there relate to representation. So if you notice how the boards are built, how the advisory committees work in the system, you will see that we still have a lot of lack of representation at many levels. So you said, well, I speak English, so I'm a native English speaker, but I'm part of a minority because whatever reason, who is speaking for me? So we need to find the ways to bring all these people, all these groups into the table. You are an example of this. You have many groups represented, but we need to ask, is there people outside that we can still include? Is this people, how can we do that? And because if you don't have representation in the table that is making the decision or this advising the decisions, you are missing the opportunity. There are many good intentions that lack of effectivity if at the end you don't have that people to point out, well, but this is not working for my community. This is not, or this is a better way to do it. That could be an example. So in that case, for instance, I'm talking about standard number 2 and 3, which is about recruit and support leaders that are responsible to the diverse communities.
Thank you.
I see another. What is the CAC's role with the class standards? Yes, thank you so much, Michaela. I think this is the most important one for this group. What is the CAC's role with the class standards? How can they help and give advice? My dream, my suggestion will be that you have this little, Pacific Source produce a 1 page of the class standards with a plain language, that you have that with you in your meetings. And then whenever you are discussing about a new service or about an experience, you take the class standards and begin to pass through that and ask yourself questions. Use that as a guide for questions. So if I have a problem, where the problem is being created, or how can we use the class standards to improve the opportunities of this problem to be solved? Is this a level of the governance, the leadership, or maybe it's a problem of workforce? Oh, well, okay, it's a problem of language assistance, but maybe it's not about that. Maybe it's about engagement. Maybe it's about the continuous improvement or the accountability. So the class standards is a tool that with only 15 steps help us to think and to find where the system can be improved.
So Miguel, that one pager, has that been, I guess I'd ask the staff, has that one pager been shared with CAC members? I don't recall seeing
Yes.
a one
Yeah,
pager.
but we just finished that, I think 2 weeks ago or 1 week. So you must have it. If not, Kelsey or Michaela, they have it already. So we can share with you.
Okay, great.
So thank you so much. And thank you for your comments, Larry. Thank you.
Bye.
Gracias, Miguel.
Gracias.
Thank you.
Thank you. Bye.
All right, so that's a good discussion. And speaking for myself, I'm just appreciative that our CCO is taking that so seriously and has hired staff and is applying, giving this attention. I'm sure it's not easy. It might be more easier internally at Pacific Source, but when you start looking at providers and clinics, my guess is that's not easy. But if we're trying, we're doing something. So that's all right. Well, we have a little extra time, and I think we're going to need it for this next section with Gwen and Michaela. Just take it away.
Hi, everyone. So we're going to transition to what we started last month with developing how you all want to address issues that you bring up around CCO and health council issues. So I just put the link to the document, our working document, in the chat box. So you can click on that link and you'll open a new window to a Google document, which we can all look at and work in.
Hey, Gwen.
Yeah.
Did I ask, now that I'm aware, Chris has made me very aware that we have at least one person on the telephone. How is Chris going to engage with us?
These slides were shared in the meeting packet. So she has those. When we break into small groups, you'll see that in a little bit. It'll be auditory for her, but we'll be sharing.
What page is that, Gwen?
Michaela, you made the meeting packet. So what it'll say is a slide that says collaborating to build CAC's process for handling emerging issues.
It's page 9.
Okay, thank you.
Thanks, Teresa. So you have the link so you can follow along if you want, and we'll be working it in small groups in a few minutes. I was asked to kind of give a high level overview of what this process is going to look like, and this will probably be the last meeting for a little while that we'll be working as a large group, since you all said we'd like to have a small group work on this offline. But this gives you, slide 2 gives you a better understanding of the big picture of what this looks like to build a process and to collaborate on that as partners. The first step is to understand better, which we started last month, and we're going to continue and finish up this month. And that's around having a shared understanding of why we need to do this, what the background is to addressing this need, what's currently happening, how we're currently handling issues and needs that come up that we want to take somewhere, escalate, and some visioning around what we'd like the desired process to look like. That kind of unifies our thinking and understanding. Yes?
It looks like you're the only one in the document.
Oh.
It might be easier for folks if you shared it.
Yeah, sorry. Let me try that. I intended to share. I apologize. All right. Can folks see that? Okay. How's that looking, Michaela? Okay, a couple nods. All right, thank you. The second step that we're going to start on today is identifying barriers. So it's really answering the question of identifying the things that are going to keep us from having the process that we want. And then those barriers move us into developing kind of our task list of what we want to do and what our product needs to look like, so that we have the approach that we want, that everybody's happy with, that's going to get the outcome that we want from escalating issues. Then we're going to use it and give it a try, and then we'll assess it and revise it down the road. So those are kind of the high level. The benefits to doing it this way, you'll see pictorially on slide 3. Some of the outcomes are that we'll actually have a clear process. So we know the steps and where things go. We'll have know who's doing what piece, and we'll know when. We'll have a kind of a timeline of expectations for all the different people involved, whether it's a CAC member, CCO representative, OHA representative, staff member. Everybody will kind of have a shared understanding and expectations. Then we'll be able to create kind of a checklist of what are those steps. So we have those tools to be able to maintain consistency. We'll be able to potentially track our processes and our outcomes and develop that success log that folks have been talking about. And we may even, depending on you, come up with some basic foundations for some documentation or letters that may be used to escalate issues to folks outside our meetings. What we create is up to you to meet the needs, but these are some things that are often created from this process. And feel free to jump in with questions at any time. Today, what we're working on is a small piece of this. This is a process that'll unfold over a number of gatherings. Most of them will be outside this meeting time. But today we're going to spend about 30 minutes finishing up the review that we talked about around the background, the current process or the current non-process, and what we want the process to look like, our desired method. We'll do that as a large group. Then we'll break into small groups and do some idea generation, and we'll give you some examples of that, but we'll be talking about things that we don't know or things that we just haven't done before, or anything that might get in the way of us having that ideal approach for dealing with emerging issues. And then we'll come back together as a large group and just share out those ideas and then continue that work with our subgroup. Questions so far? Okay, sounds good. Then we'll continue on to slide 5. And folks who are in the blue group, I'm going to just project the slide. What the blue group started as answering last time, you can see on the screen or on the hard copy, is some of the reasons why folks identified that we need to develop a process, something that a shared process. Some of the things you can see on there is that it takes time to allocate time towards dealing with these issues. We want direction for how to move forward. We want a process for members to navigate. Without a process, the issue might not be addressed. It might fall through the cracks. They also defined an emerging issue as potentially legislative change, OHA requirement, issues that affect clients, something that's fallen through the cracks and is becoming more of an issue for consumers. And then they started some conversation around emerging issues and some organizations that they might escalate issues to. So what I'd like to do for just the next 10 minutes is see what else the rest of the group would like to add to this that didn't have a chance to look at this slide so far. So are there any additional reasons that we need this process that you don't see articulated on here that we want to add? Brad?
Yeah, I just wanted to read the bullet point that you skipped over that I think is actually probably the most important, that we need accountability to ourselves, our roles as advisory to the board and our communities. That seems like a really critical one.
Yes. Yeah, I did scan them because I know you all have visual on it. So. Chris?
I'm reading it.
Okay, great. I'll give you guys a couple minutes and then you can chime in if there's anything you'd like to add.
This is Linda. I think another reason we need the process is that we need a mechanism to measure whether the problem changes or not as a result of our feedback.
Measure, say that one more time, Linda. I'm not firing great
Measure
today.
whether the problem gets resolved or not.
Yeah, so you, with following up Linda, you probably should include some sort of time or timeline or benchmarks that we could, because that also helps us keep accountable and stay on track
Right.
Yeah.
and make sure that we're actually accomplishing. Because I think a lot of what Pacific Source does and then trickles down to the CAC, as you look at the big picture, the mission statement, I mean, that's exactly what standard one was the mission state from Miguel. But that's when you've accomplished all of this and you're constantly accomplishing it, you've hit the mission statement. I think in the process, the mission statement's there, but getting to it is often not happening. So if we can figure out how to make sure we're accountable and they're accountable and we're actually meeting everyone's needs, we'd be rock stars.
Thank you. Are
Thanks,
we ready?
I just want to call out Larry's question in the chat.
Thank
Is
you.
this the process for allocating money?
No, this is for when in the past we've had CAC members in the meeting come up during hot topics, or maybe somebody from the public come to the meeting and during public comment or during other conversations say, hey, we want more information on this, or something's broken. What do we do with this? So it's specifically around those instances where there's something that's not on the agenda that we think needs to be addressed and could be addressed by CAC. Does that help, Larry? Okay.
Thanks, Ben.
Thanks. Thank you for calling that out. All right, so let's move on to the next section. We define emerging issues as things that legislative change or OHA requirement, all issues, and find out how widespread the issue is. All issues including CCO clients, assuming that's CCO clients, because that's kind of our scope. Is it an urgent issue? Something that has fallen through the cracks and is becoming more of an issue for the consumers? What would any folks like to add to this, if anything? This may be pretty comprehensive at this point.
How about resources? Because a lot of what we do, or issues that come up are addressed by other entities that maybe that's one of the things that we can look into, who deals with that we can refer to or get expertise from, or you know, maybe they've already solved it and we don't need to reinvent the wheel.
So if I say resource related issues, would that?
Yeah, I don't know how to help me, you guys. You're nonprofit people. You know, there seems to be so many organizations in Central Oregon alone that are addressing stuff anyway. So maybe it's just a guideline that we look into. I don't really know how to say it. Help. Do we know what, do you guys understand what I'm trying to say, kind of?
Would you mind restating it? I was sort of spacing out when you started.
Okay, so I'm thinking, because the issue, let's just randomly say issue X comes up, but it's being dealt with by organization K. But we don't know that. So how do we put this in, maybe that it's something we go back to and say, who's already dealing with this? So we're not reinventing a plan and et cetera. I don't know, maybe that.
Yeah, no, that makes sense. That makes sense. Well, I think that's in the, thanks, Teresa. That's the way I'm understanding this, is that would be part of the exploratory steps in the process. We would ask that question. Is anybody else addressing this? How can we find out?
Okay.
Yeah.
I'm just racking my brain. I'm trying to rack my brain. Thank you.
And at this point, I think part of the difficulty is we don't always know what an emerging issue is. There's some good qualities in here, I think, that'll get us started. So, and I did highlight that it could be resource related. So whether it's money or who's doing what, that could be a very concrete emerging issue. So what's within scope? Anything related to the mission of the CAC? And anything that Brad, were you?
Since we're advisory to the board, I would say include the board's mission. I mean, they're aligned, but.
And I would add that it's anything, not just CAC, but anything related to an OHP member's experience.
Anything related to an OHP member experience? Great. Board of directors.
Regional health improvement plan to open it wide open.
Yeah. So that's within our scope, yeah, as a CAC. Ugh. And what are some organizations that we might escalate issues to outside, or, you know, different organizations that we partner with? What pops into mind as those organizations that we might want to escalate issues to?
Gwen, I'm not clear about your question.
Yeah, so like think of so the CAC members themselves might not be able to solve a problem. Can we make a best guess at who our partner organizations are that we would say, hey, can you give us more information on this? Or hey, we'd like to see something different happen on this issue.
My immediate thought about that is that it would depend on the nature of the issue. So for example, if we started hearing at meetings that CAC members are missing their appointments and we dig a little deeper and find that it's because there's inadequacy in the transportation system, then we would look at who are the current providers of transportation, how does that system work, what are the gaps? So the who we would call on would be different depending on the nature of the issue.
Mhm. Okay, so it'd be dependent on the nature of the issue. Are there any specific, some of the ones that come to mind, just to be clear on, would be like OHA or Pacific Source?
I would think that by sharing the issue as we've identified it and we're researching it, if we share that with the board, we've noticed there's an issue where we'll get back to you when we develop more information or data. The feedback from the board, or based on a question from us, or maybe even spontaneously, could indicate, oh, this is a serious one, work with Pacific Source on it, or it's one we need to bump to OHA, or it's one that may be specific to a practice, which would probably then go back to Pacific Source.
Mhm.
I think you should go up the chain. You know, let's assume it should go to all of those entities. But I also think that one of the problems that I think is really hard is, again, Pacific Source has this mission and then has all these entities that delegate this, and there's a break between each entity. So nobody really knows what's going on. So I wonder if there's a way to figure out the chain, so to speak, and just communicate with all of them. That's big.
It is.
But I'm dreaming. Aren't we supposed to be dreamers? Anyway.
All right. Does this kind of give us a picture of, give us a little bit more information to move forward with?
Mm-hmm.
So it could be real diverse. It could be, you know, one entity. It could be multiple entities. So, and then let's move into a little quick touchy-feely. What do you want the current? What do we want the desired method? I guess that should be. What do we want it to feel like? So use some of those emotion words. So getting out of our left language brain, moving into our right brain of, you know, emotions, pictures, feelings. What do we want the experience to be like? This kind of taps into a different creative part of us, and that's why I ask.
There you go. Effective.
Effective.
Responsive.
Responsive.
Resolution.
Resolution.
Accountability.
Accountable.
Respectful.
Respectful.
Supportive.
Supportive. I see fulfilling in the chat box. One or two more? Okay. Wonderful. All right, let's do another quick review. I want to make sure we have time to do some barrier breakdown, barrier identification. So some of the places that people have identified that we'll hear about emerging issues during these parts of the meeting would be at the beginning, during the announcements, during the community or public comment, through a patient story, or perhaps an action in the minutes. It could come through any agenda item. Any other parts that we haven't called out here that we might hear about it?
Press.
What's that?
The press.
Oh, okay. Yeah, and you would probably be bringing it up into the meeting based on hearing it through the press. Anecdotally, so meaning like just generally speaking, if we look at the instances where this has come up, what generally happens is group identified that someone from Pacific Source or the Health Council staff volunteers to address or look into an issue. It might be resolved. There's no follow-up by CAC. Sometimes it comes up in a follow-up action agenda items. It gets overlooked, it's addressed, and then forgotten. Would anybody like to add anything to that, or does that kind of encompass the general thoughts? And then the current method feels, it was expressed that it feels like there's no closure. We're left lingering, inconsistent, not knowing if our concerns are important to the people we're speaking to, and not knowing if our needs are being addressed. Is there anything else that's different from what we see here that folks would like to add about what the current method feels like? Oh,
maybe this is just the way it is, and that's unfortunately.
Mm-hmm. So it feels it's just the way it is.
Yeah.
Okay. And then the other thing that's on here that I left out was overloaded. We never get to solving the issue. It's always on to the next thing.
Mm-hmm.
So anything else that folks would like to identify as how the current method feels it's different than what we have up here?
I think people get, well, I'll speak for myself. I think I get frustrated and then I give up and stop trying. So I think that's a red flag for people to make sure we're actually addressing things. Oh.
Thank you for that vulnerability. That's great. Thank you.
Yeah, people can say something, but it's about backing it up. And that's what I see, is that I think I have an idea of what good healthcare is, what our rights are, but it just, I don't see it happening.
Mm-hmm. Yeah. Thank you.
And just to add, sorry, just to add a little bit of positivity. I do, I do think we've. I'm not sure if they would be considered emerging issues or not, but through the minutes and identifying in the minutes actions that somebody agreed to take, or some type of a need for an action, and highlighting that, and then checking in on those when we come back together the next time. I think that's been one thing that has worked fairly well. But again, maybe those aren't truly emerging issues that we're really talking about here.
No, I like that.
I think that's true if we check in, but to be honest, like I had an action item last week, not for me to do, but to do with me, and it didn't occur, and I just gave up. So anyway, so I didn't say anything because I'm starting to struggle with, and what I'm saying and wanting, is that about me or is it about everyone in the CAC? So that's a personal conflict I'm trying to figure out. So I didn't say anything.
No, good call out, because I think that's the question too. Is it one-off and we need individual support, or is it a sign of is it a symptom of something much larger that we don't know? So, yeah, and then what happens? So moving on to some visioning, shift the energy a little bit. What do we want the desired method to do this? And we've got feedback loop, be a consistent process. What do we want it to do? Just throw some things out.
What is feedback loop?
This is Linda. I would want it to be measurable. Are we talking about one person's experience, or is it something that is happening more often that indicates a systemic issue?
How do we find out? What's a feedback loop? Sorry.
Would somebody share what a feedback loop is?
somehow you get data that what you're doing is, I don't know what it is. I'm just guessing.
I would look to somebody who is in this group to share what they were intending with that. Typically what it means is if it follows a circle, so if we send something out, it comes back to us.
Okay.
So there's that communication, actions, whatever we put out comes back, we know what happens.
Okay.
Brett, go ahead.
I was going to say, yeah, good communication and follow through so that the circle gets closed. Yeah.
Okay. Thank you.
Great question. I see in the chat box, make change. Thank you, Mandy. And address the symptoms that are broken.
And I would add another one, which is that we have a recording system to track how often this issue comes up. So the first time it comes up, we investigate. We don't think it's happening very often. We find 3 months later, it's coming up again. If we're not tracking each time that it comes up, it will be impossible to know whether it's an emerging issue or we just have a series of one-offs.
Nice. Great. So let's go ahead. What we're going to do next, I'm going to give a little bit of instruction as a group, and then we're going to break into small groups to add to this. So what we're moving on to is the next stage of identifying what's going to keep us from having this approach, this method that we envision with all these qualities and feelings that you've expressed. So we're going to do some brainstorming about what's going to keep us from developing that. What you see on the screen, or it's slide 10, is some of the, what's that?
I didn't know what slide we're on. I'm sorry. Okay, yeah, I got it.
Sorry. Shifted up to slide 10. Slide 9 is intentionally left blank. So shifting to 10. Thanks, Lauren.
Thank you.
What I did to just kind of get folks started was populate some of the barriers that you had called out in our earlier conversations and put them here. Some of the things that you've identified as we don't know if the issue is isolated or widespread. We don't have enough time to discuss the issue at the meeting. We don't get follow-up and the issue is forgotten. We don't know what or if an issue is urgent. And so what we're going to do, and then you can see on slide 11 for the other small group, we've got a couple of other examples as well of things that you've already identified. What I want to do is give small groups a little bit more time to add more barriers to this list, because from those barriers, we're going to build solutions. We're going to figure out what we need to do to make it, to break down that barrier so we can build our process. Michaela and I will be in small groups with you to talk you through this, but this is simply just idea generating. And then we'll come back together as a large group in probably 5 minutes, see what you can add to it, and report out. And then from there, we'll use this offline groups to work on it. Does that sound okay? Okay.
Yep.
What's that?
Yeah.
Okay, thank you. So what I'm gonna do, I'm gonna open rooms. Actually, I need to move a few folks around. Hold on. Okay, so I'm gonna go ahead and open rooms. Michaela is gonna be in room blue, and I will be joining room green in just a moment. So we'll see you there. Welcome back, everyone. Quick, but it'll get the small group a good strong start when they meet. Could I have the blue group share out some of the barriers that you identified? And I'm projecting, and if you'll just read out, the folks who are on the phone can listen along. So who from the blue group would be kind enough to share.
Teresa, do you want to go?
And you can just read it and have folks chime in as you need to. Let me share the screen. Hold on. That could help.
That could help. Teresa, are you willing to read
What am I reading?
the additional barriers that we added?
Okay. So we don't know what progress has been made or by whom. So just assuming we're reinventing the wheel over and over again, we try and avoid that. We might not be hearing about all the issues, not in touch with all our consumers. And consumers don't really know we exist, which I think is probably big.
I find in the rural area where I live, this is Lauren, in the rural area I live, the people that I know, like the neighbors or people that I have talked to, I don't get I shouldn't say this, but I feel like that they don't care. I don't, a couple people will express to me, you know, like having to go for treatment and going, you know, there's nobody in Bend, they have to go to Portland, they can't get a ride, or how long it takes to get into something. But I think the people that I see in this very rural area are just kind of complacent with that. So I'll be looking for people that are a little bit more jazzed up about, you know, making a change.
Thanks, Lauren. Teresa, can you
that.
go ahead? We're past time, so I just want to give a quick summary. That's okay. Teresa, could you finish up the last 2 or 3?
Yeah.
Thanks.
Don't know how to find out if other consumers are experiencing the same thing. And people don't believe that we can do anything about the barrier they've given up.
Great.
The barriers.
Thanks. And then what's this one in the middle? It says CAC members communicate issues experienced.
It's more of heading towards a solution for us as members sharing our individual stories with each other to get a sense of whether our issues personally are beyond ourselves.
Thank you. Okay, great. And which the smaller group will dive into here. Yeah,
I like that.
weeks. And then group 2, the green group, would somebody like to share out? Were you able to add any to the barriers, or were these barriers where you landed for today?
I don't know.
Chris, Larry, Regina.
Yeah, okay. Yeah, I think that what we kind of decided was that, and I really don't want to speak for the whole group, but what the impression I got was that they're made clear that we just have a lack of providers, period. Even if we are able to try to connect people, we need more providers, specifically in addiction treatment and in dental care. There's a profound, and I may add psychiatrists, and yeah, so just a lack of providers is a problem for us.
Especially like in the dental for OHP. There's a lot of dental out there, but they don't all accept OHP.
I would
Very
like
limited.
to know, sorry, don't mean to interrupt. Why? I mean, I know that people work to try to get dental providers, but why are people turning us down, businesses, and why won't they do it? And why? I'm just throwing it out there. If we knew why.
Underpaid.
Because they're underpaid. It can't just be that.
I don't know. That's the only thing I can think of.
It can't. I can't believe, like, for example, there's 15 periodontists in Bend, but I guess OHP doesn't cover periodontist, so that's a bad example because I didn't know that originally. But none of them will take OHP clients. So this is a bad example. Never mind.
No, I think it's Teresa, I think I would actually propose that we take that on as our first emerging issue, if that's a significant.
really
issue.
is.
We could actually address that and use our new process. Yeah.
Well, the other thing that, and this goes up the chain of the command, and I'm trying to figure out how to connect this too, is like the dental care organizations, Pacific Source dropped one, picked up another, which is now Capital, or the organization dropped Pacific Source. I don't really know, but I would like to know, because I think if you understand why people do things, then we can start addressing the problem. But under that organization of Capital, there's only one dentist.
Yeah, exactly. So it doesn't matter how many DCOs they get.
Right.
We still only have a handful of dentists that will accept OHP. And how many people do we have in our area?
A lot.
And how many people can they see? So I mean, again, same with the addiction. Like it takes months before you can go and get detoxed or get assessed to even start a program to start your life. And by that time, that's not even your priority anymore to be clean. Or
Right.
Well, yeah, no, I want to clarify that a little bit though. I get people into detox all the time. And I think Best Care is doing a really good job at that now. So the problem is getting personal support once you're done with detox.
I just talked to him. If you're a single mom and you're pregnant, you get in pretty quick. But if you're a young guy, and then there's a single mom or that's pregnant, or they're going to go before you. And so that's where you have to fall in those regulations before you can even get in. I'm not saying that they're not doing a good job, but we have so many and not everybody's getting the help.
Yeah, no, that's for sure. But I want to be clear that just in the last month, I probably have gotten half dozen on a pretty, I was kind of amazed at how quickly they got in. So I just want to be clear on that, but we definitely need more. That's for sure. What we need are people to connect them to, for sure.
But that's my point. I think if we knew why, it's, if we understood why they're not doing it.
I hate to stop.
I know we have to cut.
Fantastic discussion, but we are over time, and but I do want to, let's put those two issues on the table for possible emerging issues that we can work through our new system as we develop it. Does that sound good?
Yeah.
Yep.
And there was periodontists, and was it behavioral health specifically?
Well, just dental itself, because periodontists might not even be covered, but just oral, preventative care. So for oral.
It's weird. Yeah, I'd like to know, because periodontists, while you can go to a periodontist if you drive to Salem, but you can't go to one here. Why?
Yeah. All right. Thank you. I just wanted to clarify that so we have that for minutes. Thank you.
Yeah, thanks everybody. Would somebody like to motion that we adjourn? I don't think we usually do that, but let's do that.
Goodbye.
I motion to adjourn.
All right.
Yep. I second the motion.
All right.
I third.
Thanks everybody.
Thanks, everybody.
Thank you.
Bye.